मेरा नाम उत्तम नायक है। मैं उड़ीसा से भद्रक ज़िला से हूँ। बेंगलोर में काम कर रहा था, आकाश हॉस्पिटल रोड में कंस्ट्रक्शन कंपनी में। सितंबर 17 तारीख को रात 10:30 बजे कोई आके एसिड फेंक के चला गया। उसका बाद मुझे बहुत तकलीफ़ हुआ। मेरा होश उड़ गया। कब मेरा होश आया मुझे मालूम नहीं। फिर हमारा सार लोग आए और कंपनी का प्रोजेक्ट मैनेजर वो विजय चौहान और जोशी सर, उनको मैं थैंक्स बोलता। वो मुझे लेके एलंका आस्टर हॉस्पिटल में एडमिट किए। कृष्णा जा कंपनी का जो मालिक है उनको भी मैं थैंक्स बोलना चाहता हूँ। वो कोविड के समय जो भी हेल्प किया बहुत किए। फिर मेरा इलाज आस्टर हॉस्पिटल में शुरू हो गया और जो डॉक्टर मधुसूदन सर, महेश सर, उनको भी मैं थैंक्स बोलता हूँ। वो हमको बोले ठीक है, चिंता मत करो, हम कुछ करते हैं। मिला फोन को उनके साथ बात करके मेरे पास आए, क्या क्या हुआ हमने बताया और मिला फोन को मैं भी धन्यवाद कहता हूँ। एसिड अटैक के बाद मुझे जब हॉस्पिटल में जब होश आया, मैं देखा मेरा सिर पूरा जल गया, आँख बेकार हो गया, एक कान भी जल गया, सारा शरीर जल गया और मैंने जीने का इच्छा छोड़ दिया। मेरे पापा का याद आया, जितना भी तकलीफ़ होगा मुझे जीना होगा, मेरी माँ और मेरे पापा के लिए। आँखों का डॉक्टर वो आए, उनका नाम अश्विन सर है, उनको भी धन्यवाद देता और बोले उत्तम तुम्हारा आँख पूरा जल गया, मैं कोशिश करता हूँ तुम्हारा आँख को बचाने के लिए। उन्होंने बहुत कोशिश किया, वो कोशिश का फल भी मिल गया, मुझे थोड़ा थोड़ा दिखाई देता है। उनको भी मैं बहुत थैंक्स बोलता हूँ। डॉक्टर मधुसूदन सर, वो भी मुझे बहुत जाके हर दिन बोलते उत्तम कुछ नहीं होगा, हम लोग हैं, कुछ करेंगे, बल्कि हिम्मत मत हारो। मिलाप के साथ कांटेक्ट किया, मिलाप से जो पैसा आया था वो मेरा इलाज हुआ। मेरा इलाज होना है, ये इधर एक सर्जरी होना है कान का और ये बॉडी भी जल गया, उसको भी करना है। आस्टर हॉस्पिटल में एक सिस्टर है, उनका नाम लक्ष्मी सिस्टर है, उनको मैं बहुत थैंक्स बोलता हूँ। आप लोग कुछ हेल्प करो।
I'm Dr. Mahesh MS, plastic surgeon. We worked in hand with Dr. Ashwin Shetty, the ophthalmic surgeon who was treating him. And the main priority was here for the eye closure. He had developed burns over both upper and lower eyelid of the right eye. So the first thing to facilitate the eye closure was to correct the correction of the ectropion. So we did this with release of these contractures in the upper and lower eyelid and skin grafting. We had to do a full thickness skin graft for a quality closure. So that was our priority and we did that fast. The next stage was early wound closure. So what we did was like the linear wounds over the anterior chest and the abdomen, we closed that primarily by suturing, and which were not amenable for primary closure, like the large area wounds over the upper limb and the chest, we had to skin graft it. The next step was the wounds over the face, neck and the scalp. The coverage of the scalp was, since it was a composite wound, we kept it at the end of at the end stage, and which required a microvascular cover. So first we had to treat the neck wounds and the face wounds. So here we debrided the eschar over the face and the right side of the neck. Then for the quality wound cover here, to prevent the contractures further after wound healing, we had to do application of an integra which is a dermal substrate, gives a quality wound cover and avoids contracture. We had to put integra as a dermal substrate in the right side of the face at the neck area. Did a vac dressing, that is a negative pressure wound therapy with over this integra for next 3 weeks. Following this 3 weeks, we removed the outer layer of the silicone of the integra and we put the skin graft, and the wounds over the face and the right side of the neck totally healed. Then the last step, we proceeded to the scalp area. We did the debridement again, and we had a huge large surface area of the scalp that needed a good cover. We planned for a muzzle flap, a microvascular muzzle flap from the back of the chest. We did a microvascular latissimus dorsi muzzle flap to cover the scalp wound, which we connected the blood vessels to the neck.
Mr. Uttam Nayak came to us in the middle of September last year with a very severe acid injury to the right side of his face. Both the upper and lower eyelids were quite badly burnt. The entire surface of the eye was quite badly damaged. It's what we call a grade 4 chemical injury, the most severe form there is. So the entire surface of his left eye was completely damaged because of the acid which had been thrown into his face and his eyes. Our initial treatment was basically emergency management, and then we immediately took him up for an amniotic membrane graft to prevent his eye from getting really bad. The one thing we worry about in such eyes in the initial stage of the damaged phase is that the cornea, which is the black part of the eye, it can start melting and completely perforate, or a hole can form in the eye. And if it reaches that stage, then it is very, very difficult to salvage the eye at that stage, because doing a corneal transplant and other things which we can normally do in other situations will completely fail in such cases. So our initial part of our management was primarily focused on preventing his cornea from perforating in the right eye. So because of that, we immediately did an amniotic membrane graft within the first 2 to 3 days of him getting admitted. Once he was stable enough to take him up under general anesthesia, his eyelids were very badly burnt, because of which the eye was completely open. So the plastic surgery team in fact came in and they put in a skin graft on his lower eyelid. So that allowed us to close his eye. Otherwise his eye was completely open, and there's nothing much really we can do if the eyes don't close. So they had to come in and put a skin graft, which allowed me to close the eye with sutures. Once the amniotic membrane graft dissolved away, there was still a lot of surface problems, so I had to repeat the graft almost 2 more times. And by that time he was reaching a stage where it was kind of stabilizing. He wasn't okay yet, but he was kind of stabilizing. In February this year, we attempted something called simple limbal epithelial transplant. We took some stem cell tissue from his left eye, which was his healthy eye, and we transplanted it into his right eye. There was still a lot of inflammation in the eye and it wasn't healing, so we took a chance and we tried this procedure in his right eye. Although it didn't achieve the result I was hoping for, that is a complete epithelialization, it did help the conjunctiva, which is the tissue around the cornea, to grow over the cornea completely, which wasn't happening before I did the slit. So as of now, his cornea is completely covered by conjunctiva and his cornea is safe. It's not likely to perforate anymore.
Dr. Madhusudan, plastic surgeon from the Aster Hospital. Regarding Mr. Uttam Nayak, it was challenging from the day one. We could not have gone for a head and neck facial wound debridement initially, because we need to make sure that the eye was dealt well. So as Dr. Mahesh explained, we did take a staged approach, treating the primarily closable areas first, graftable areas first, and later on dealing each part of his wound only to dress him, because further treatment needed excision and a microvascular flap cover and integra application for the neck wounds, remove his ear, right ear, and plant something for the area for a further ear reconstruction. So at that time we got help from the MLAP crowdfunding, and thanks to the lot of supporters who had funded for his treatment, we could arrange a handsome of money for which was needed for his further treatment. So meanwhile 3 weeks of the stage gap occurred where we did only regular dressing for his wounds, but still there was a lot of wound related infection which was MRSA, which is one of the worst infection that can happen in the wounds. We had to treat that infection further and then go ahead for the reconstruction. Second stage management of this burn wounds are also important. One was that a ophthalmic management of doing a limbal grafting to make sure that his right eye is safe for a further corneal transplant, and the patient wanted a year because he was so emotional that he lost his right ear. We had no option of ear reconstruction with autologous tissue because there was no normal surrounding skin in the right half of the neck and face. We had to go for a prosthetic ear, and with the help of prosthetic team, silicone ear process was made and given to him. And he was on regular follow-up. We gave him compression garments which he wore. In spite of that, because these acid burns were so severe and deep, they will lead to secondary deformities. So with the amount of what he had fund collected, we could do one surgery possible so that we did in November 2020 when we collated all whatever best possible release which could do. We released his right side angle of the mouth, we released his neck contracture, right side of the neck, as well as the shoulder contracture, right axilla contracture, and excised the hard hypertrophic scar of the right side of the abdomen which was severely painful, and did the skin grafting in the meanwhile. So now in December 2021 all his wounds have healed, though there is some residual contracture still present which needs to be evaluated and treated in a later date, maybe say after 6 months to 1 year. Now Mr. Uttam Nayak is ready to society.